This is the part 5 of chapter Pharmaceuticals. In this part, we will see synthesis and uses of some drugs. First class of drugs that we are going to see is antimalarials. Those drugs which act against malarial condition, these are known as antimalarials. Antimalarials are chemotherapeutic agents which are used for the prevention and treatment of the tropical disease malaria. It is caused by genus Plasmodium, which is of the class of protozoa known as sporozoa. There are four different species which are responsible for human malaria, namely Plasmodium malarii, Plasmodium ovale, Plasmodium vivax, and Plasmodium falciparum. In the earlier days, the extract of the bark of cinchona tree was used against malaria. It is nothing but cinchona alkaloid quinine. The quinine has now been replaced by synthetic antimalarials such as chloroquine, primaquine, plasmoquine, mepacrine, proguanil, that is paludrin, etc. So first antimalarial drug, that is paludrin, also known as proguanil or fluoroguanide. IUPAC nomenclature of this compound is 1,4-chlorophenyl 5-isopropyl biguanide, and it is biguanide derivative. It is usually used in the form of its hydrochloride salt known as paludrine hydrochloride or proguanyl hydrochloride. It was synthesized in England during the World War II by Curd, Davy, and Rose in 1945. The structure is this one. Synthesis of this antimalarial drug consists of two steps. First step is preparation of parachlorophenyl cyanoguanide, that is first compound, this first. And the reaction sequence is parachloroaniline on treatment with sodium nitrite in presence of dilute HCl at 0 degree Celsius. Diazotization reaction takes place and yields parachlorobenzene diazonium chloride. This is diazonium salt. This parachlorodiazonium parachlorobenzene diazonium chloride further react with cyanoguanidine. This is the structure of cyanoguanidine, and we get parachlorophenyl cyanoguanidine with HCl and nitrogen gas. This first compound, that is Parachlorophenyl cyanoguanidine, which is synthesized in this first step, it is used in the second step for further synthesis. So in second step, condensation of this parachlorophenyl guanidine synthesized in the first step condense or react with isopropyl amine, and condensation reaction takes place in presence of copper sulfate CuSO4. Directly we get paludrin, and the condensation reaction is the second step. Uses of this paludrin drug: first, it is an anti-malarial drug. It is active against pre-erythrocytic forms of malaria. It is superior to chloroquine and mepacrine. It is least toxic anti-malaria. These are the uses. Second, anti-tubercular drugs. TB is the major disease, and tuberculosis or TB is systemic infectious disease. It is caused by Mycobacterium species, namely Mycobacterium tuberculosis in man and Mycobacterium bovis in animals. About 1 to 2 million people die every year due to this disease. The drugs which are used in the treatment of infectious disease tuberculosis caused by Mycobacterium species are known as antituberculars or antitubercular agents. Commonly, tuberculosis is disease of respiratory transmission. A person gets infected when he comes in contact with environment contaminated with viable tubercular bacilli. These bacilli are expelled by coughing, sneezing, shouting, and singing of the patient with active tuberculosis. Affected person develop anorexia, grows weaker, and lose weight. The different chemotherapeutic agents used for treatment of TB are para-aminosalicylic acid, isoniazid, ethambutol, ethionamide, and pyrazinamide. These are some of the examples. So let us see first, that is isoniazide. It is also known as remifon, isoniazid. The structure is isonicotinic acid hydrazide, pyridine ring, and two pyridine ring CONHNH2. It was introduced in 1952 as an extremely effective and safe anti-mycobacterial agent. It is the hydrazide of isonicotinic acid, pyridine 4-carboxylic acid. But pyridine 4-carboxylic acid is known as isonicotinic acid. It is very active anti-tubercular drug used under the generic name isoniazid, and it has been abbreviated as INH. INH, isoniazid. Synthesis of isoniazid. This 4-methylpyridine on oxidation in presence of vanadium pentoxide or chromium trioxide forms isonicotinic acid. This isonicotinic acid on esterification in presence of ethanol gives isonicotinic acid ester, and this isonicotinic acid ester further reacts with hydrogen hydrate, and finally we get isoniazid. Uses of isoniazide: it acts an bacteriostatic as well as bactericidal anti-TB agent. It finds use in the treatment of pulmonary TB in combination with other antitubercular agents. It is also successfully employed in the treatment of lupus vulgaris, tuberculosis of skin. It should always be included in the therapy of the more dangerous forms of tuberculosis such as miliary, widespread tuberculosis, meningitis, CNS tuberculosis, and pulmonary respiratory tuberculosis pertaining to lungs tuberculosis, etc. Resistance to isoniazid develop rapidly, and hence it usually gives along with para-aminosalicylic acid, that is PAS. Its side effects are headache, mental abnormalities, dryness of mouth, allergic reactions. Then second anti-TB agent, that is ethambutol. The structure is, this is symmetric structure. So here same structure. So we can draw a mirror plane of symmetry from this. So it is base 1 hydroxymethylpropyl ethylene diamide. Ethambutol. Ethambutol is used as dihydrochloride. Its dextro form has been 200 times more active than leo form. So synthesis of ethambutol in first step, preparation of 2-amino 1-butanol. This 1-nitropropane on reaction with formaldehyde in presence of sodium hydroxide forms 2-nitrobutanol, 2-nitro-1-butanol. This 2-nitro-1-butanol on reduction in presence of ranitidine nickel or iron in presence of H2SO4, FeH2SO4, and gives 2-amino 1-butanol after reaction with calcium hydroxide. In the second step, the reaction of this 2-amino 1-butanol, which is formed in the first step, with 1,2-dichloroethane. 2-amino 1-butanol, this formed in the first step, is treated with 1,2-dichloroethane. But here 2-amino 1-butanol is used twice in the mole proportion as compared with 1,2-dichloroethane. That is, two molecules of 2-amino 1-butanol reacts with one molecule of 1,2-dichloroethane. Directly condensation reaction takes place, and here condensation takes place and one molecule is formed, that is ethambutol. Uses of ethambutol: it is used in the treatment of pulmonary tuberculosis. It is more effective in combination with isoniazid or Rifamycin, when it is given with rifamycin and sometimes with capreomycin, it finds use in the treatment of pulmonary tuberculosis resistant to isoniazid, streptomycin, or para-aminosalicylic acid PAS. It is given either orally or by injection. It possesses adverse effects such as nausea, vomiting, headache, diminished visual activity, etc. Third one, CNS drugs. So drugs acting on the central nervous system are known as CNS drugs. Their types are anesthetics, hypnotics, sedatives, anticonvulsants, tranquilizers, and CNS stimulants that we have already seen in the introductory section. So first CNS drug, that is phenobarbital. It is also known as phenobarbital, luminal, gardena. The early drugs used to prevent epileptic seizures were barbiturates. And these barbiturates are generally central nervous system depressants. The parent compound of barbiturate is barbituric acid. The derivatives are obtained by making substitution in position 5 of the molecule. So here this 5-ethyl 5-phenyl barbituric acid. So this is 5-ethyl 5-phenyl barbituric acid. This is phenobarbital, and this phenobarbital can be synthesized by the reaction sequence given here. In the in this reaction sequence, benzyl cyanide on condensation with diethyl carbonate forms 2-cyano-2-phenyl ethyl acetate. This is the first intermediate. This 2-cyano-2-phenyl ethyl acetate further, upon hydrolysis in presence of H2SO4 and after esterification, yields phenyl diethyl malonate second. And this phenyl diethyl malonate on C alkylation, phenyl ethyl phenyl diethyl malonate on C alkylation in presence of sodium and ethyl bromide yields ethyl phenyl diethyl malonate. This ethyl phenyl diethyl malonate react with urea, condensation reaction takes place, and we get phenobarbital. These are the uses of phenobarbital. It is used both as sedative and hypnotic. Already we have seen the definitions of sedative and hypnotic. It is also effective in the control of epileptic seizures, grand mal seizures, and psychomotor attacks. It can be used to treat general convulsions in children. It is used as anticonvulsant and in the treatment of petit mal epilepsy. It is slower in its on-site action, that is it require about 1 hour to show effect, but duration of action is 10 to 16 hours. That means its effect persists, retains for 10 to 16 hours. Fourth category of drug, that is anti-diabetic. Those drugs which are used in the diabetic condition are known as anti-diabetic. So diabetes mellitus is the condition arising due to the abnormal metabolism of carbohydrate, fat and protein. This disease is caused due to the deficiency of insulin, and insulin is the protein hormone secreted by beta cells of pancreas. Insulin is responsible for the proper carbohydrate metabolism. Diabetes is characterized by hypoglycemia, hyperglycemia, not hypoglycemia. Hyper, that means more, excessive sugar in the blood than the threshold value, and glycosuria, presence of sugar in urine. The symptoms associated with the disease are polydipsia, that means increased thirst, then polyuria, increased urinary output, and ketonemia and ketouria, presence of ketone bodies in blood and urine. Ketonemia is nothing but presence of ketone bodies in blood, and ketouria means presence of ketone bodies in urine. Antidiabetic or hypoglycemic agents are the substances which are able to lower the blood sugar and find use to treat the symptoms of diabetes mellitus. Tolbutamide is the sulfonamide drug, that is anti-diabetic drug. It is derivative of urea. The structure of urea, so this one, if we see NH2 C double bond O NH2, here one H is replaced by this group and another H is replaced by this group. That means it is a derivative of urea. In it, aryl sulfonyl group is attached to one nitrogen atom and aliphatic group is attached to another nitrogen atom. These type of antidiabetics are known as sulfonylureas. Tolbutamide is a synthetic oral hypoglycemic agent. Synthesis of tolbutamide: paratoluene sulfonyl chloride. This compound, on reaction with urea, forms paratoluene sulfonyl urea. This is paratoluene toluene sulfonyl urea. This paratoluene sulfonyl urea, on treatment with N-butyl chloride, 1, 2, 3, 4, N-butyl chloride, the condensation reaction takes place and we get tolbutamide. Uses of tolbutamide: it is an oral hypoglycemic agent, that is antidiabetic drug which can be taken orally through mouth. It stimulates the secretion of insulin by beta cells of pancreas. Its effect lasts for 8 to 10 hours with a single dose. It also inhibits glycogenolysis in the liver. It is ineffective when the pancreas are not functioning. This drug will not work if pancreas are damaged. This is the drawback of tolbutamide. Anti-inflammatory drugs. Inflammations may be defined as the series of changes that takes place in the living tissue following injury. This injury may be caused by variety of conditions like physical agents, mechanical trauma, ultraviolet or ionizing radiations, chemical agents, toxins, various bacteria, and so on. The drugs which are used in the management of inflammation are known as anti-inflammatory drugs. These modify inflammatory response to disease but not curative and do not remove the underlying cause of the disease. That means these anti-inflammatory drugs only act against inflammation, but they do not eradicate the root cause of the inflammation. Rheumatic diseases are considered to be the most important inflammatory conditions. These include rheumatoid arthritis, that is RA, osteoarthritis, ankylosing spondylitis. Earlier, various steroids such as prednisolone, betamethasone, hydrocortisone were used as anti-inflammatory agents. That is, these are steroids. But due to their several adverse effects, they have been more or less replaced by much safer non-steroidal anti-inflammatory drug NSAID, non-steroidal anti-inflammatory drugs such as ibuprofen, mefenamic acid, naproxen, etc. So ibuprofen, it is commonly known as brufen. The structure is 2 para isobutyl phenyl propionic acid. So 1, 2, 3. 2 para isobutyl phenyl propionic acid. Numerous phenylacetic acid and propionic acid derivative possesses anti-inflammatory activity. Most commonly used agents are ibuprofen, indomethacin, etc. The synthesis of ibuprofen, isobutyl benzene on acetylation with the help of acetic anhydride in presence of AlCl3, Lewis acid. Acetylation reaction takes place and we get para isobutyl acetophenone. This para isobutyl acetophenone reacts with hydrogen cyanide and we get corresponding cyanohydrine. This cyanohydrine further heating with hydrogen iodide Hi and red phosphorus. After hydrolysis, we get ibuprofen. The benzylic hydroxyl group reduces and hydrolysis of nitrile group gives us acid functionality. So finally we get ibuprofen. Uses of ibuprofen, it is an anti-inflammatory drug. It possesses antipyretic and analgesic actions. It is used for treatment of rheumatoid arthritis and osteoarthritis. It is also recommended to arrest acute flares and in the long term management of these diseases. Ibuprofen should neither be recommended for use by pregnant women nor by those who are breastfeeding their infants. That means mothers and to be mothers are not recommended to take this medicine.